So I just was wondering if you could think about like how is it helpful to have me here in the school instead of having to go to the doctor's office? Can you talk about that a little bit?
Yeah, it's really nice because I don't have to miss any classes, especially STEM and mathematics and science and English and every one of them. I want to be able to, like, yeah, I just want to be able to be there and not miss out.
So a school-based health center is when we have a provider, nurse practitioner, or a pediatrician who's embedded in the schools and can see patients, see kids in the schools for medical care.
The initial spark, I would say, was even though this office is right up the street from the school, it wasn't always easy for kids to access care.
We collected data from 16 different schools around the state. We really wanted to see what kinds of conditions kids were being seen for. So about 20% of kids were seen for mental health issues, about 20% seen for things like colds, sore throats, but there were also a variety of other conditions being addressed, reproductive health issues.
We have a lot of families here in our rural community that struggle with transportation, especially.
Before we had the school-based health clinic, there was a lot of kids who just didn't get follow-up. They just didn't. Their parents couldn't miss work.
It was definitely challenging for our parents to be able to get out of work, so a lot of times they wouldn't take the time for the appointments, so the students wouldn't be getting what they need.
So I became a school nurse in the school year 2010-11, and I remember those first early weeks coming home and telling my husband, gosh, I wish there was a doctor's office. Like, I wish there was a doctor at the school. We send home so many students and they never come back.
We found that over 80% of kids, if they were seen in a school-based health center, returned to class, which is really great data to show how school-based health centers really support kids in their learning environment and allow them to have more time in school.
We had a child who was rocking in his chair, fell forward, hit his face on the desk and had a laceration on his cheek. And he came in and we were able to quickly call mom. And he was able to be seen, have his laceration glued, and be assessed for concussion within, probably 45 minutes and get back to class. Right there, we eliminated the need for him to be out for the rest of the school day. We saved an ER visit, and mom was able to stay at work.
And so I think having this school-based health clinic really helps keep that continuity of care, especially across the academic setting too. They can pop in for a 15-30-minute appointment here at school and not really miss out on that academic time, whether it's first thing in the morning or in the afternoon.
And then finally, we found that on average, kids saved about 3.5 hours in learning by being seen in a school-based health center.
So particularly for some of our outlying schools that might be 30 or 40 minutes away from the health center, we found that a lot of these students didn't have primary care providers. So by locating one of our clinicians in their school, we were able to provide supportive preventative well care that they didn't have access to before. It also allows us to do closer follow-up on some of the chronic conditions like asthma or managing medications that might have taken months to get patients back in. But because we're there every week, we can provide that close support and make changes much more quickly.
I think we just had one come in just a minute ago who made her own appointment, and so I think that especially as the kids are getting older, it empowers them to take control of their health and advocate for their needs.
I was in gym class and I tripped and I fell on my wrist really hard, and it was like I had a game that day. It's like, oh crap. And it was really convenient to come here and then not actually leave campus.
Just being able to have that accessibility within the school where the child is all day long is a huge deal. I was a single parent with 3 kids. There was no way that I was able to get my kids to all of their regular appointments. Having a school-based health center saved us multiple times.
In Vermont, school-based health centers are typically a collaboration between schools and medical centers, and the sponsors of school-based health centers tend to be the medical center.
It's always challenging when you're thinking about another organization coming into the school and another person to have to partner with and communicate with, but the amount of benefit that we've gotten out of having Gifford come right into our school, I think the benefit far outweighs the struggle that you might have getting it set up.
I think the benefit of having a school-based health center from the perspective of Gifford administration is it provides a different kind of access to care for our students and our pediatric patients.
We are breaking down the barriers to keep these kids in class learning, because ultimately that is all of our goals, healthy and in-school learning.
This is not a moneymaker. This is the right thing to do. We need to get patients seen. We need patients to be consistent. We need to be providing them with education, preemptive education, and this is a great way to do it. And it is the best way to create a new access point without clogging up the rest of your practice.
There are a lot of other states that have quite robust funding for school-based health centers that come from the state. An opportunity exists to provide some more support and structure to these so that we can have a wider network.
I think funding for school-based health clinics is really important when we think about healthcare in our state. It allows for our workforce to stay at the workforce, so like parents not missing work. It allows our students to stay in school so that they're accessing their education, and it makes sure that we're providing preventative medical care so little things don't become big things that cause both parents and students to miss work or school. So by having us embedded in the schools, we provide better care for our state as a whole.
I think my hope for school health in Vermont is that it's just the way we do business. That bringing together health resources and educational resources into the same spaces, serving the same families in a really aligned and family-centered, integrated way is just the way we operate. I think we already see pockets of that across the state, and figuring out how we can amplify those efforts and troubleshoot with folks who want to be in that space to really make it successful, I think is just such an opportunity for us.